So again, welcome to our webinar series, Improving HPV and Pediatric Influenza Vaccination Rates in Louisiana. We are so pleased that you could join us today. We hope this webinar and virtual community will be a place where you can not only learn from our speakers, but also your peers. During this webinar series, you will hear from experts and have the opportunity to ask questions and share. And we're going to show you just a brief overview of what we'll be going through today. This educational series is made possible through funding from the American Academy of Pediatrics and brought to you by the following partners: the American Cancer Society, Bureau of Family Health, School-Based Health Centers, the Louisiana AAP, Louisiana Office of Public Health Immunization Program, Louisiana Primary Care Association, the Louisiana Shots for Tots Coalition, the LSU Health Science Center Dental Program, and the Southeast Louisiana AHEC. The Louisiana AAP is accredited by the Louisiana State Medical Society to provide continuing medical education for physicians. The Louisiana AAP designates this live activity for a maximum of 1.0 AMA PRA credit category 1. Physicians should claim only the credit commensurate with the extent of their participation in this activity. This activity has been provider approved for 1.1 contact hours of nursing continuing education by Workplace Nurses LLC. Workplace Nurses LLC is approved as a provider of nursing continuing education by the California Board of Registered Nursing. All improving HPV and pediatric influenza vaccination rates in Louisiana Planning Committee members have indicated they have nothing to disclose. We also want to let you know that this session is being recorded for educational purposes. A video of this presentation will be shared following today's presentation. By participating in this webinar, you give your acknowledgement and consent for the recording. As such, please ensure that patient privacy is protected and do not provide any PHI during today's Q&A period. Please make sure your microphone is muted during this session. You will have the ability to mute and unmute yourself to participate in today's call. If you are having any IT difficulties today, please chat Ashley Pulitz or call, and you can call and text her at 225-505-7611, and she'll be able to assist you. If you have video capabilities and you'd like to ask a question during our Q&A session, we do encourage you to come off of mute. We'd love for this to be as interactive and engaging as possible. And finally, if you haven't done so already, please enter your name and where you're from in our chat box so we can get to know each other a little bit better, and it'll help us capture your attendance. So today, our presenter is Dr. Shannon Stokely. Dr. Stokely is the Associate Director for Science in the Immunization Services Division at the National Center for Immunization and Respiratory Diseases at the CDC. She has over 20 years of experience conducting health service research to improve vaccination coverage for children, adolescents, and adults. She joined CDC in 1996, as an epidemiologist, and from 2006 to 2013 served as the lead for the adolescent vaccination team. Her research focus has been on strengthening provider recommendations for HPV vaccine, implementing effective interventions to improve HPV vaccination coverage, and reducing disparities in coverage. Dr. Stokely received her Bachelor's of Science degree in biology from University of California, Riverside, a Master's of Public Health and Epidemiology from San Diego State University, and a Doctorate of Public Health from the University of North Carolina, Chapel Hill. We are so pleased that you could join us today. Dr. Stokely, I'm going to pass it off to you whenever you're ready.
Hi, and thanks. So I'm just going to go off video 1 second while I try to share my screen. And are you able to see the slides?
Yes, we can see your slides.
Okay, I'm trying to get it to start. There it goes. Okay, perfect. So hi everyone, and I guess it's afternoon, right? Or morning where you are. Thanks for having me today, and I'm happy to talk today about what's a really important issue for us, and that is a call to action to get kids caught up on their routine vaccines. So today I'm going to give an overview of what our data is showing us with respect to decreases in vaccination as a result of the pandemic. And then also talk about our call to action and some strategies to help improve coverage. And this is just my disclosure slide, so I have no conflicts of interest to disclose. And I think we've all been impacted by the COVID-19 pandemic. Personally, professionally, it feels like this year or 2020 is never ending. So this slide shows the beginning of the pandemic and the impact that we started to see early on in the first few months of COVID-19. And that is just a drop in the number of visits to ambulatory care sites. And we saw about a 60% drop in visits. And part of this is due to, states having a shutdown, implementing, policies at the time. And so there may have been, practices that may have limited their services. So this is what happened at the very beginning. At the same time, we saw a drop in orders of routine vaccines through our Vaccines for Children program. And so this is an article that was published last year showing the large drop in orders. And again, this is just for those that get vaccines through the Vaccines for Children program. We didn't have data on the private side, but we know there was a drop there as well. One good piece of information is we are starting to see a rebound in visits, in child visits to clinic, to offices. So like we said, in the very beginning of the pandemic, there was about a 60% drop in visits. And now we're seeing September and October of last year, we're back at 2019 levels for visits. So that is good news. But something to keep in mind is that when children are missing visits, there's definitely variation across age and race ethnicity. And this is one study that showed that evaluated missed visits, especially for well visits by age of the child. And they were looking at children from birth through age 5 years. And we definitely see a pattern here in that children who are older, meaning 18 months or older, were more likely to have a missed visit. There were fewer missed visits among children in the first year of life. And that may be because some practices were prioritizing visits for newborns and infants. There's also a lot more visits during that time, and a lot of that, it's important for those well visits, especially that first year of life. So that might be why we're seeing a difference by age. Unfortunately, the study didn't include adolescents, but I think if we were to extrapolate this and assume that the trend continues with older ages, we would expect that even adolescents have even fewer or more missed visits during 2020. And when we look at this by race ethnicity, we also see differences. And again, this was done among middle upper income households. So presumably these are families that have the ability or have access to healthcare. But we do see that Black and Latino children had more missed visits than white children. We have looked at our orders for routine vaccine for the VFC program by week, like we did at the beginning of the pandemic. And this just shows every week from January 2020 through our most recent data poll, which was April 5th of this year. We are seeing that orders are rebounding. We are close to 2019 levels. So the orders from 2019 are shown in the blue bars, and the orders for the same time period, but either in 2020 or 2021, depending on where you are in the calendar, and that's shown in orange. So again, at the beginning of the pandemic, you see a big drop in orders. The orange bars are definitely less than the blue bars, but looking now at March, April, we're seeing we're back to 2019 levels. So that's good news. However, it doesn't tell the complete story. What we know is that there is a cumulative number of kids that are still behind, because getting back to 2019 levels is not enough. That is good, but there's all those kids that missed vaccinations during 2020, And then we also have kids that are now aging into new vaccine recommendations. So just getting to 2019 levels is not going to get us back to where we need to be when all those kids missed visits and missed vaccines, plus the new kids that are aging into recommendations. We really should be giving more than 2019 levels to get everyone caught up. And so when we look cumulatively over time, we're down about 1.5 million doses for measles and 11.5 million doses for all non-influenza vaccines. So there's still a considerable deficit in children being behind the routine vaccinations. And when we look at HPV, it's a similar story. So this just shows orders over time, from 2020 and 2021. We see that, again, a sharp drop during the early months of the pandemic. But now looking at, April 5th, we're back to 2019 levels. But again, when you look at the cumulative deficit, we're still about 1.2 million doses behind where we should be had all those kids come in, as expected. So there's still a large deficit in HPV vaccination. This shows where we're at for Tdap, just for comparison, because we know adolescents, if they're getting all their vaccines together when they come in for their 11 and 12-year-old visit, they would get HPV, Tdap, and meningococcal vaccine. So for Tdap, our deficit is around 800,000 doses. And then for meningococcal vaccine, it's around 825,000 doses. So we're still at a big deficit for adolescents. When we look overall among all routine vaccines, we see the gap and the deficit is lower for infants. And again, that's probably because they have been prioritized to get them back in and keep them up to date for routine vaccines. But for Tdap, we're down about 20%, same with HPV, and around 16% for meningococcal conjugate vaccines. And even more concerning is measles is down 20%. And we know, given anytime our measles vaccination coverage goes down, we're at risk of an outbreak, as we saw pre-pandemic and the large measles outbreak that we had in 2019. So this is definitely concerning, and we really want to get kids back in the office so we can get them caught up and make sure they're protected. Lastly, this shows vaccination coverage for influenza vaccine for children, and this goes through age 17 years, and it's shown here by race, ethnicity. This is some preliminary data for the 2020-2021 season. This hasn't been published yet, but you can see that through January 2nd, vaccination coverage for flu is lower than what we're seeing for the previous season. And there are disparities by race, ethnicity, and some of those disparities actually got larger. So we're definitely behind in flu vaccination coverage as well. And hopefully with the upcoming flu season, we can get kids back on track and get coverage up to at least where we were before the pandemic. A lot of focus has been on getting kids back to in-person school, and a lot of states and counties are working to get kids back in person. I'm not sure of the situation in Louisiana, but I know many schools are working, putting in policies and procedures in place so that kids can come back in person and have a safe environment. And this was just an article in the Washington Post about one particular school district that worked really hard to get kids back in person and to get parents feeling comfortable about their kids going back to school. And while they were very successful, there was one piece in the article that really stood out to us. And that was, many parents wanted to get their kids back in person. One of the challenges they had is that their kids were behind on required vaccinations. And so we don't want to get in a situation where, come the 2021-2022 school season, that most schools will likely be open, but kids, won't be able to attend immediately because they're behind on their school required vaccinations. One other study that we did is we collaborated with the University of Colorado to survey pediatricians and family physicians about some of their practices during the pandemic. And this was done about September and October of last year, just asking about the impact of the pandemic on their routine practices. And one of the questions we asked was, did you suspend routine vaccination for your patients at any time during the pandemic? And a small proportion said yes. So, and it varied by age group of their patients. So there were, especially among pediatricians, they were least likely to suspend vaccination for infants, but about 24% did suspend vaccination for adolescents 11 to 18 years of age. So that's probably, it's definitely in line with what we're seeing in terms of vaccine orders. We also asked about barriers to providing vaccine during the pandemic. And we asked about several barriers, but these three listed here were the top three barriers that were mentioned. And one being, fewer in-person visits, because parents are concerned about taking their children to the doctor's office because of the risk of COVID. Fewer in-person visits for sports clearance, so there's fewer opportunities to engage with adolescents and patients, and probably because schools may have paused sports activities, so the clearances may not have been needed. But then also fewer back to school visits because children were participating in virtual learning, because many kids were not in person at school. Schools may not have been enforcing school requirements, so there wasn't this urgency to get them into the doctors to get them caught up on vaccines. So missing opportunities to make sure kids are up to date. And so all of this brings us, drives home the point that we need to help catch up our kids to make sure they're up to date on vaccines, one, so that they're protected themselves, but two, to also help facilitate the return to in-person school, because we know these vaccines are, several vaccines are required for school entry and I'm not sure what the exact requirements are for Louisiana, but I'm assuming it's Tdap and maybe meningococcal vaccine. We need to make sure kids are up to date so that when schools are open, they can go back in person. And we know many of these kids missed their routine vaccines during the past year, and especially adolescents. We're not sure what schools are going to be doing regarding compliance, if they're going to alter any of their requirements in the coming school year. And we also don't know if or when a COVID-19 vaccine is going to be available for children. I know there was an application by Pfizer for an emergency use authorization going down to age 12. It's likely that FDA will make a decision soon, probably in the next month or so. And we're not sure what the recommendations are going to be from ACIP, especially as it relates to co-administration of other vaccines. We don't know if it will be okay to administer COVID with, say, Tdap or with meningococcal or HPV vaccines. So because there's a lot of unknowns, what we do know is we can get kids caught up now on their routine vaccines before we have to think about COVID-19 vaccine. So, our emphasis now is just getting them caught up on the routine vaccines so that you don't have to worry about the co-administration issue with COVID-19 vaccine. CDC has developed a website for the call to action and created a toolkit to help clinicians get kids back in the office to get them caught up on their vaccinations. This is the landing page for the toolkit. And we are updating the site as more materials become available. So it's something that you can go back to over time to see if new materials have been added. But the call to action is really about getting kids in to get them caught up and provide some strategies for getting children back in. For healthcare systems and providers, really identifying those families whose children have missed doses and contacting them to get them back in and to schedule an appointment. This could be, there's different ways of doing reminder recall, but really it's identifying who's behind and working with the families to get them back in the office. You can also utilize your electronic health records or use the immunization information system to develop prompts to remind clinicians when the patient is in the office, if a vaccine is needed, to remind the clinician to give the vaccine. And of course, communicating with parents to let them know what precautions are in place so that they know they are entering a safe environment to get care for their children. And I'm sure many of you are already doing that just routinely because of routine care as well. Healthcare provider organizations should also encourage and identify families and do the reminder recall to get people back into the office. And then among schools and governments, again, sending reminders to families about what will be required with the new school year and what policies will be in place. And then following up with families, with kids who might be out of compliance with the requirements. And again, conducting reminder recall as well, and directing families back to their medical homes to get vaccinated if they have a medical home. And again, all of us should be communicating directly with all families and patients about the importance of well-child visits. I know I'm speaking to the choir, but again, reminding parents why it's so important to get their kids caught up on vaccines. So that's an overview of my presentation today, but I'm happy to answer questions, happy to talk more about any or all of this.
Oh, wow.
Stop sharing my screen there, but happy to take questions.
Thank you so much. That was such wonderful information. Yeah, we'd like to open the floor if anybody has questions for Dr. Stokely. So I had a question, and I like that you mentioned different things that different either provider groups or folks can do to kind of get back on track and increase screening rates. Is there anything that you've seen with even health insurance plans that maybe they could be doing, or even on the public health side as far as coalitions and the work that we do?
Right. I mean, I think insurance plans, they can reach out to their members and just provide general information about the need for vaccination. I don't know if they routinely review the status of their members and whether or not they're behind on vaccinations, but it's definitely a way for them to send information to all of their members to remind them, if they have missed visits or missed vaccines for their children, to definitely reach out to their clinician, their provider, and schedule a visit, and presumably it's covered by the insurance plan. But yeah, definitely. And coalitions, of course. I mean, they're always an important partner at getting the message out and working through their networks and their stakeholders to reach parents and to remind them of how important this is.
Yeah, thank you. It's great information. And we have a question in the chat box. Is there a way to help stop disinformation that families are being told online or seeing on social media?
Is there a way to stop it? I don't know. That's a hard one, but I recognize, disinformation, it's a challenge. It's a challenge for all of us. And for us, what we've been trying to promote is confidence in vaccinations. We have a new program called Vaccinate with Confidence, and there's a website on CDC, and I apologize, I don't have the exact website right now, but I can provide that to you later. But we have a lot of materials focused on how to message vaccination to patients and to the public. I guess the best thing is not engage with the trolls that may be out there and sending some information, but really, listening to your patients, understanding what their concerns are and addressing, their needs, and just providing, that, we know patients trust their clinicians. You are the most trusted source of information. And so what you say matters, and just listening to their concerns and really addressing it head on, and just, providing the information that you have to reassure them that these vaccines are safe. But I recognize it's a challenge when there's a lot of noise out there and other social media platforms and other venues. It can be really challenging.
Yeah, absolutely. Thank you for answering that. Do we have any other questions? Feel free to come off of mute or put your questions in the chat box.
If not, I have a question for the group.
Yes, please.
Given that COVID vaccine may be coming available for children, like what concerns are you having, and what concerns do you have with that impacting your ability to provide routine vaccines? Is that something you've thought about, or what are you hearing from your patients?
This is Jasmine from American Cancer Society. Basically, the biggest concern, I guess, now is people wondering what's in vaccines. Like, that is the main thing. The COVID-19 vaccines have definitely stirred this big pot up, right? So like all the stuff that were social norms and acceptable, my kids have to have certain vaccinations and adults have to have certain vaccinations, has now become a problem. Even with the J&J vaccine, having those issues. And we all know inside of the clinic setting that you will find issues. I mean, when there's clinical trials, it's a good thing to find those problems early on so that it can be amended and, fixed so that we can have these vaccines around for a long time and they still be effective. So the biggest thing is changing the culture of vaccines, changing the culture of immunizations, all around, trying to figure out ways to, I don't want to say convince, but provide that educational piece to make people understand what and why we do what we do. People were upset about having possibility of vaccine passports, I'm sorry. But we know that when you go to other countries, you have to have that information many times. So it's not like it's something new that's like the wheel is being reinvented. We've always had anti-vaxxers and we know how to combat them. We just have to come up with better ways. And I think that wording and messaging and, these pictorials of why kids need to be vaccinated, or like getting back to school, to go to school, they'll need this vaccination. I think we have to change that. We have to make it, this is why, when the big meningococcal stuff came out, when they were talking about meningitis, there were people telling their stories about how they were losing limbs, how they were losing, different senses. And that resonated with the people because you're thinking, oh, I don't want my child to die from this. I don't want my child to lose anything. And I think that you don't want to put any fear in it, but you want to use that as a platform to say, okay, this is what we have to go off. And, nobody made a big thing about going to college and, oh, my child has to get a meningococcal shot. They were just like, you have to have this. I remember when I was in undergrad, if you didn't have those vaccine records on file, they took you off the roster. So, and I mean, calling your parents, calling your primary care doctors, like there was one time I had to come all the way to New Orleans because I didn't have something. I was going to school in Atlanta. And so it's just one of those things, kids can't play sports when they don't have vaccines and stuff. So it's like, why are we making it such a big deal? Why are we trying to reinvent the wheel and come up with a more creative way to say things? But if we just say them with the passion that we have for vaccinations behind it, what we know about vaccinations, what has been proven over the years, everybody wants to take this whole, the Tuskegee experiment is the same thing. Clinical trials go on every day. every single day, whether it's devices, whether it's the drug, whether it's anything. And nobody questions that the way they're questioning the COVID-19 vaccine. It's the way that we've presented the information. When we present the information and say, oh yeah, the EUA has approved it, not the FDA, but why was that information, needed to be put that way? Because now you have the two like bumping heads. They're like, oh, well, it was approved for emergency authorization, but not by the FDA. So, we have to do that. People put stuff in their bodies every single day that we don't know what's in it. We go to the grocery store and buy produce. You don't know who grew that. You don't know who touched it. You can rinse it off, but it could be inside of it. We don't know that. It's the same thing with like contraceptives and all those different extra things. People don't know what's in that stuff, but yet and still they still take them. They still consume it. So we have to make the messaging more conclusive and understanding. I mean, how many times
Jasmine, I think that's a really good point. And I think it kind of speaks to exactly what you're saying. Messaging is so important, but also, our interventions and how we're trying to make some of those policy and systems changes. So yeah, I agree. That's a really great point. Thank you for sharing.
Yeah. No, thank you. I totally agree. I see there's one question in the chat about messaging on anticipation of COVID-19 vaccine. Right now, I think, we're not, without an actual approval or authorization, without an ACIP recommendation, it is a little challenging to message because we don't have complete information yet. We know they're looking into it. We know they're considering it. And so you can tell families that this is under consideration. And if it's approved, it may be as young as age 12. But beyond that, we're not sure yet, until the decision's actually made, it's hard to really message it. But what I would focus on is, while they're figuring that out, let's make sure you're in and up to date on all your routine vaccines. Like that is critical. And then you can think about COVID when that decision is made and we have more information.
Do we have any additional questions?
Hey, this is Ashley. One of the things that we are looking to kind of put together education for our pediatrician members is around becoming COVID-19 vaccinators. Our state has now allowed vaccinators to kind of only have to accept their patient panel and kind of families, right? It's not a wide open to anybody who wants to get a vaccine at your clinic, which from what we heard from other providers in other states, that was one of the big downsides to becoming a COVID-19 vaccinator. So any thoughts on that expansion of who's doing vaccinations? What does that look like? How do we make sure that we're getting everybody and it's getting into a system that we can track it and know that the timing is right and those kinds of things? Any thoughts?
Yeah, so I mean, there's a lot of discussions going on right now about how to expand access, in the event that this is approved for adolescents. How are we going to get adolescents vaccinated? And so we are in discussions about how to roll out this program. And right now for COVID vaccination, the majority of vaccinators are public health, large hospitals. There's a lot of mass vaccination clinics and pharmacies, of course, federally qualified health centers, and then a few select sites like long-term care facilities and like that. So part of what is going to be the constraint is just how the vaccine is ordered, how it's packaged, and storage requirements, because a minimum order is extremely large. It is not, it's several thousand doses. So some small providers may not at this moment be able to actually manage those conditions. And so it's something that we really have to think about and be strategic about, to, you know, take advantage of the sites that already exist for vaccination and those that are appropriate to, you know, administer vaccines to adolescents and really take advantage of that. And then also thinking strategically about which providers serve a large number of adolescents and can manage all the conditions that are around the COVID vaccines and can administer it to their patients, and so that we minimize wastage. So a lot of this is being thought about and discussed. Decisions have not been made. But if a provider does become a COVID vaccine provider, there are a lot of conditions and activities that they have to agree to. One of them is being the reporting of the vaccination. So anyone who's a COVID vaccine provider has to report the administration to the state or local registry. And then that data gets uploaded and sent to CDC every day. So I don't know in Louisiana how many providers are already reporting to the registry, especially pediatricians, family physicians, but that is something that will definitely, if you do become a COVID vaccine provider, that is a really important component of the program. And so from that, you know, the registry is going to be the great source of knowing, you know, if someone's been vaccinated previously, if, you know, what type of vaccine they got. So if they have to have a second dose, knowing which product they need to receive. All of that will be in the registry and can assist delivery of the vaccination, especially the adolescents.
So Dr. Stickley, just for point of clarification, is that entering into each state's immunization registry, or is this a registry specific for COVID-19?
No, it's the state vaccine registry. So whatever is used in Louisiana, I forget what it's called. Apologies.
It's called links.
Links, right.
Yes.
So if you're a provider administering COVID vaccine, you submit to links. So it's not a new system. It's the existing IIS for the state.
Great. Thank you so much for that clarification.
Any other additional questions or comments? Okay, and I see that Links does have COVID vaccine listed. Thank you for that. All right, well, thank you so much, Dr. Stilkey. That was a wonderful presentation and exceptional information. And we so appreciate you taking your time to join us today and share your great wealth of knowledge. This is something that we're obviously all interested in and are, you know, going to be working on for the next foreseeable future. So we do appreciate your time and your wonderful information.
Yeah, thank you for having me and good luck.
Thank you. And we just for all of our attendees, we put a survey in the chat for you. So if you would fill that out for our evaluation. And like I said before, you'll be receiving these slides and this information in a follow-up email. So thank you.